In this episode of Medicine in Blue and White, back to school and back to sport could add up to trouble.
You don't really know what's going on. You're just in a fog.
A revolutionary new way to treat aneurysms.
It was scary. I had none of the risk factors, no symptoms at all related to the aneurysms.
The mind at rest, or restless.
I just realized I was waking up exhausted.
Pioneering robotic surgery.
They're an extension of our hands. They act like our hands.
And pioneering the science of medicine itself.
The future of medicine is small, really small.
You'll find it all here at Penn State Milton S. Hershey Medical Center. Founded in 1963, committed to enhancing the quality of life, educating future generations, and discovering what lies ahead. Here you will find the full spectrum of what it means to be human: dreams, fears, hope. Doctors, nurses, and researchers, where time-honored values meet the latest in breakthrough technologies, with the most important goals always in mind: to heal the sick, ease the suffering, and make life a little better when you can. It is medicine in blue and white. Keep your eye on the ball carrier, number 81. His name is Lucas Grudai. He's 15 years old, and his mother, who is videotaping him from the stands, is about to ask a terrifying question.
He looks like he's over. Why isn't he getting up?
Lucas has just suffered a concussion, and unfortunately not his first. In fact, Lucas suffered a concussion each year he played football, beginning in the 7th grade. Until 2 years ago, in his sophomore year of high school, that's when he got 3.
At one point, I just remember kind of waking up and being like, what's going on? Like, what am I doing here? That's when they took me aside. They're like, all right, come aside.
You could just see it was a hard hit. And it's tough as a parent to see that. And you could see that he was getting up slowly, and of course you're concerned. And then later, seeing the side effects, several of the concussions, he was very confused, couldn't remember things.
Not so long ago, it was estimated that about 300,000 concussions occurred each year. Today, that number is between 2 and 3 million. The numbers are growing so rapidly because the diagnosis of what constitutes a concussion has broadened considerably.
The definition of a concussion is a trauma that causes a mental status change or some type of symptom that suggests brain injury.
We used to think that concussion was defined by loss of consciousness, and now we know that that only happens in about 10% of concussions. So we were missing 90% of concussion just based on a definition. So when the definition was changed, the numbers really started to increase. Good to see you. Hi. Good to see you guys. How do you feel your memory is at this point in time?
It's still lagging.
Okay.
Can't remember a lot.
16-year-old Jonathan has had 5 recent concussions playing hockey, a sport he loves that isn't loving him back. His symptoms are common: headache, dizziness, fatigue, poor concentration, poor memory, and moodiness, to name a few. But unlike the majority of patients who recover within 7 to 10 days, Jonathan is in the 10 to 15% who have ongoing problems. But problems or not, he still wants to get back in the game.
I want you to be active too, I really do. We just want you to be active and not be making your symptoms worse. And we want to avoid activities that put you at risk for head injury right now until you've kind of recuperated.
Okay.
So we talked last time, right? Or our ideas last time that we had.
Biking, swimming, golf.
Good.
There's a summer league for hockey that's non-contact.
Nice try. No.
Though the numbers are increasing, much of what the experts know about what happens to the brain during a concussion remains a mystery. Dr. Harry Bramley sees close to 30 patients a week in Penn State Hershey's concussion clinic.
There's no definitive data or studies that I can go to say that this athlete with 3 concussions with more prolonged symptoms is at greater risk. I think it's all individualized we as physicians have to try to come up with a risk assessment. So I think the more you have, the more prolonged symptoms you have with each concussion, the more likely you are to get more, the more risk you are in playing, and probably the more risk you have for complications later on down the road.
It's the later on down the road subjects that Dr. Robert Harbaugh is researching for the National Football League. He was chosen by the NFL to head a committee set up to figure out what causes long-term neurological dysfunction in some pro players.
What we'd like to do is develop a prospective database that looks at not only the environment, what happens to the player both during games and during practice, but at genetic factors, body mass index, other things that may be very important in leading to late neurological decline.
He and his team hope to collect data on every NFL player and follow them throughout their careers and into retirement. There's no doubt that the information gained from the long-term study will benefit just about everyone who plays sports at any level, because the stakes are high and the numbers are nothing to fool around with. And information gleaned from better imaging will help as well. Scientists, doctors, and researchers at Penn State Hershey are working to improve MRI scans of the brain to give them a better picture of what happens during a concussion. That technology is evolving. For today, though, there is the big picture to keep in mind and decisions to be made, tough ones, to play or not to play. Coming up next on Medicine in Blue and White.
Can I do all the things that I want to do, bicycling, traveling, or do I need to have this surgery right away? Am I going to die?
Penn State Milton S. Hershey Medical Center. From concussion to brain matter of a different sort. What's new in neurosurgery? Chances are, if you look up the word happy in the dictionary, you will see a picture of Dawn Temple, on the road, in her element. She bikes a couple of 100 miles a week. She takes good care of herself. So you can imagine just how shocked she was to find out that she had not one, but 2 brain aneurysms.
I was in the hospital for a really unrelated issue, and an MRI of my brain was completed, and they found that I had 2 aneurysms at the time.
A cerebral or brain aneurysm occurs when weakness in an artery or vein causes the blood vessel to balloon. Although they have been linked with both smoking and high blood pressure, they occur without any particular cause or reason and produce little or no symptoms. While the death rate after an aneurysm ruptures is high, about 50%, studies indicate the average aneurysm only has a 1 to 2% chance of ever doing so, and they're more common than we might think. It's estimated that 1 in 50 people have an aneurysm and don't know it, and 20% of those individuals have more than one. Patients like Dawn Temple.
Okay, well these are some of your pictures from the second aneurysm we treated. This set of pictures right here, this is looking kind of at an angle through your eye on the right side.
Traditionally, aneurysms like Dawn's would have been treated with small coils to close them off. Enter Onyx HD 500, a new treatment. Think of it as liquid glue that completely fills the balloon in the blood vessel, effectively closing it off. Penn State Hershey is one of only 3 hospitals across Pennsylvania using the new technology.
When you put the coils in, even though you may think you've filled it, you've really only filled about 25% or less of the volume of the aneurysm. And so over time, those coils can sort of push up into the aneurysm and it regrows. So with the Onyx, instead you get 100%, it's a liquid, it's not compressible, and so the recurrence rates are lower and you can treat some of these broader-based aneurysms more effectively.
I'm very glad that they were found and that there was treatment available.
James Bittenbender is retired now, but for years he made his living as a cook in Lancaster, Pennsylvania. A smoker for almost 50 years, he was diagnosed recently with cancer of the upper portion of his voice box. Head and neck cancers account for approximately 5% of all cancers in the United States. They are more common in men and in people over 50 years old. For James Bittenbender, it all started with a scratchy throat.
And it kept getting worse and worse, and well, people kept telling me to go away, but it didn't go away. So finally I told my family doctor all over again, look, you got to do something with this throat now.
His next move, James came to Penn State Hershey to see Dr. David Goldenberg.
Head and neck cancer, when it first appears, often has very subtle signs that mimic nothing more than laryngitis or a cold or a sore. Anything that persists for more than a couple of weeks, especially in a patient with a history of smoking and drinking, needs to be taken seriously.
Dr. Goldenberg now uses robotic surgery technology to remove head and neck cancers in a way never done before. And James Bittenbender's cancer is a good candidate for the new procedure, saving him a lot of time, pain, and possible disfigurement.
There was a time where we'd have to go in and take out the entire patient's voice box, and in those cases, the patient might need a tracheotomy or would not be able to speak or swallow adequately. If we were to do a similar approach to this, we would have to open up the patient's neck widely, almost from ear to ear.
Not anymore. With the help of robot-assisted technology, surgeons can go through the patient's mouth to remove tumors, which is especially effective with cancers of the upper portion of the throat.
The instruments that actually go in the mouth are about the width of a pencil. They can move and hold things. They're an extension of our hands. They act like our hands.
Dr. Goldenberg is continuing to pioneer new uses for robotic surgery. He recently removed a cancerous tumor near the base of a patient's skull through a very small incision in the neck, the first surgery of its kind. Coming up next on Medicine in Blue and White, a hard day's night.
I felt like I didn't even sleep.
Charlene Cleary is an account executive for a medical equipment company. She is on the go, literally from the time she wakes up, visiting clients during the day and completing paperwork in the evening. About 3 years ago, she started losing some energy and gaining some weight. She wasn't too worried about it because she thought it was just part of the natural aging process. Then her blood pressure spiked and the headaches began.
I woke up exhausted. I felt like I didn't even sleep. I was in bed all night, but I didn't feel like I had any rest. I'm a go-getter. I'm always on top of my game.
She came here to Penn State Hershey's Sleep Treatment and Research Center and was diagnosed with moderate sleep apnea, a sleep disorder characterized by abnormal pauses in breathing. Charlene is one of 18 million Americans who have been diagnosed with sleep apnea. It's thought that 10 million more remain undiagnosed.
And the scary thing about it is that it tends to sneak up on people. So sleepy people don't have a lot of judgment and a lot of insight, so they often really don't quite understand just how impaired they are.
And how far-reaching the effects of sleep deprivation can be on the mind and body. Studies are showing that sleep apnea patients tend to have elevated levels of hormones that may lead to a whole host of problems. High blood pressure, diabetes, and obesity, not to mention an inability to think clearly and drowsy driving. Over 50% of all apnea cases are diagnosed in people aged 40 and older, but that doesn't mean sleep disorders only affect adults. It's estimated that more than 2 million children suffer from sleep disorders as well, but no one knows for sure.
We are collecting a lot more detailed data in terms of the sleep pattern, both in the laboratory and at home.
Dr. Ed Bixler's sleep study is the first of its kind. His team has been following 700 local school kids since 2002. What makes the study unique is that for the first time ever, scientists are looking at a general population of children, not a group already diagnosed with sleep problems. This population will help to measure just how prevalent sleep problems are. It's not an easy thing to pinpoint.
Sleep is extremely sensitive to your overall well-being. It just doesn't tell you what the problem is. It just says, hey, there's something going wrong there.
The team is now beginning a 4-year study in sleep-disordered breathing to further identify both the risk factors and possible treatments for children. In the meantime, Charlene Cleary is trying something that could change her life. From the science of sleep to science of the future. Welcome to the world of nanotechnology and the laboratories here at Penn State Hershey. Doctors and scientists are collaborating on the treatment of liver cancer, the 5th most common cancer in the world, where the 5-year survival rate is less than 5%. The challenge with chemotherapy is how to deliver it in a way that only kills the cancer cells and not the healthy ones around it. The answer could be found in nanotechnology and in making the toxic chemotherapy molecules very, very small.
I like to think of a FedEx truck really, really, really small. And then just as packages are put into the FedEx truck, we can do that with our drugs. We actually package them in the nanotechnology. And just as the packages have barcodes and say delivered to this building versus another building, we can put barcodes, information on our individual drugs. You can get through the body's defense system and you can get through the traffic and say, only deliver that package only to the tumor cell. So we can preferentially deliver these toxic agents only to the cancer cell.
The team is made up of engineers, physicists, pharmacologists, chemists, and doctors who are working with cancer patients, all eager to get nanotechnology from the bench to the bedside.
I think we've got a real opportunity here to extend what we've discovered in the laboratory, and we'll be in a good position to see if this works in patients and try to offer hope, because we see a lot of these patients.
The team is working toward a phase 1 human trial within the next year. As for the future of nanotechnology,
This is a revolution. And what I think is really neat is that within 10 years, 15 years, in my opinion, 25, 30, 50% of all the drugs that will be out there will be nanotechnology-based new drugs.
coming up next on Medicine in Blue and White.
It was a good life lesson, I'd say.
A high school athlete with a decision to make and a lot at stake. A retired cook meets the latest in surgical innovation. An account exec whose get up and go slowly got up and went. And a social worker who never knew she had not one, but 2 brain aneurysms. Lucas Grudai suffered numerous concussions. He's played football since the 7th grade and says he got a concussion at least once each season until the year he suffered with 3. He has to decide whether or not to keep playing. Say hello to a new track and field star. Lucas is no longer playing contact sports. Now he's doing the long jump, high jump, and triple jump. It's a decision he made on his own with a lot of support from his family and Dr. Matt Silvis, who continues to be a big part of Lucas's life today and perhaps even into the future.
Whenever I get a free day, I'll come in and work with him, and it's a good experience for me, and it really exposed me to the medical job path.
Lucas was able to look beyond his contact sport and say, you know what, I've had a great career in playing football in his instance, but he was able to accept the fact that the risks were probably outweighing the benefits and move on to other areas of his life. Great kid.
The future for retired cook James Bittenbender is to him nothing short of miraculous. What started as a scratchy throat that wouldn't go away was diagnosed as throat cancer. Using robotic surgery, his doctor was able to remove the tumor through the mouth. He will be back to start chemo and radiation and work with a full multidisciplinary team dedicated to treating head and neck cancers. And though he is grateful, he's also disappointed in himself. And he wants this heartfelt message to be heard by all those who continue to smoke.
Stop now while you're in good shape. Don't end up like me. I was too damn dumb to listen to anybody. If I listened long ago, I wouldn't have to do this. So if you're doing it, quit.
Charlene Cleary couldn't figure out what was going on. She was exhausted during the day and started gaining weight. She became irritable and depressed. After coming to the Penn State Hershey Sleep Treatment and Research Center, she was diagnosed with sleep apnea. She's sleeping much better these days, thanks to her CPAP machine, a common treatment for sleep apnea that forces oxygen into the body.
I do not wake up with headaches any longer. I have a lot more energy during the day. I feel rested when I wake up, which is I'm so grateful for. It really has helped a lot.
About 6 million Americans have something in common with Dawn Temple. That's how many people have unruptured brain aneurysms. Dawn had not one, but two found by accident when she had a blood vessel scan for another complaint. Today, she is back to her normal life, and her 2 aneurysms? Filled with a black glue-like liquid called Onyx HD 500.
So here's the aneurysm before, bubble right there, and this is the same projection, but now taken after, and it's basically gone. Been erased from here, and the blood vessel just looks like a tube.
Other benefits of the new Onyx HD 500 procedure include both shorter hospital stays and recovery time.
The procedure was painless. It seemed quick. I mean, I think I was under the first time about 4 hours. Woke up and then was in ICU, and I felt fine.
Dawn will continue to follow up every 6 months, just to make sure that everything is as it should be.
It's been going well after that 6 weeks. It was completely gone.
Great. Any headaches?
No, not having any.
Terrific. And
Though concerned at first, she says the whole experience has given her something she never expected.
I appreciate the gift that he's given me, not only to fix the aneurysms, but just to appreciate each day, and just to remind myself that no matter what, it is a gift each day.
Next time on Medicine in Blue and White. Dancers and Doctors, Crisis and Community, and Sir Paul McCartney. It's Medicine in Blue and White, here on the Big Ten Network. For more information on the stories featured, visit pennstatehershey.org/blue and white.